Hello, good afternoon. Today we're bringing you another podcast from Creation Balance, the first of many series. Today's guest is Dr. Collins, and I'll leave her to introduce not only herself, but the series of this podcast. Please.
Okay, thank you very much. I'm really happy to be here. I am Dr. Cindy Collins, and I am a health psychologist as well as a dietitian, and we're going to cover a lot of different topics in this series. So many different ones that have to do with your health, with your mental health as well as your physical health. A lot to do with adaptation, especially in these difficult times right now. And we're just going to let it flow to the different topics that individuals bring to us, as well as things that are on our mind, keeping up with the times, keeping up with what's going on with the many different clients that I'm involved with, as well as just our neighbors, our friends, our family. So we invite you to follow, but we truly invite your feedback so that we can cover the topics that you may be interested in as well.
Dr. Collins, we would like to have a drop back of you, your expertise, your background, and so on and forth, if you don't mind.
Okay, sure. So I started out actually with a biology degree, and honestly, that is still my first love. And even now, when I talk to patients, I go back to teaching them some basic biology about their health or whatever their disease state is. And I did that. I wasn't quite sure what I wanted to do. I was also doing a lot of hospice volunteer work at the time. And I finally went back into biochemistry and then did a lot of lab work, a lot of research, and once again fell in love with working with patients. So I became a dietitian at that point, and I was a dietitian with a master's degree for about 15 years, working mostly in oncology, although also cardiology and gastroenterology. And eventually, while I was working in oncology, I began to realize that nutrition was super important and it was a great tool for reaching patients, but I became focused on the patient's self-image, on their mood, their family relationships, their view about their health. And I realized that the actual counseling that I was doing as a dietitian, I could do with even more depth and a broader perspective. So I went back to get my doctorate in psychology, and I landed in a fantastic department at the University of Tennessee, where once again I got interested in research, but also on the counseling side. So by the time I finished, I ended up with an experimental degree in health psychology, with my dissertation being about cancer patients, looking at not only their diet, so I was able to bring forward the nutrition degree, but I also looked at their level of hope, their knowledge or understanding about their cancer, and also their coping skills. So from that time forward, I really lived and used a blend of all three degrees and a blend of my experience and my background with the help of a lot of fantastic mentors, teachers, and my colleagues currently. And I deal with everything that has to do with health psychology, which would be prevention, as well as adjustment to an illness if you do have a diagnosis, and then also the progression and the adaptation that it requires to be a resilient patient, even dealing with existentials like death and dying.
So, if I'm getting you correct, you don't have a specific field, more so you have kind of merged a few fields and created a lane for yourself.
That's true, and this happened over time, and I love counseling students now who also have a variety of interests, and they have a difficult time deciding between one thing or the other. I really think it's a great idea to look at your interests and your talents and to try to make a blend, or as I always called it, a synthesis of what it is that you're interested in and you're capable of doing. But it does take being patient and allowing all these things come together over time. I actually had one mentor in my past, a surgeon, who just insisted at one point that I needed to choose between teaching or research or counseling or biology or psychology. And I just said, I can't. I'm going to have to find my own synthesis, my own blend of doing this. And I still think if it's possible, that it's a great way to
go. For the layperson, you mentioned part of your portfolio is being a nutritionist. But from the work that we understand that you do, Explain to the best of your capabilities your level of nutritionist to the lay person who walks in the gym and sees somebody with a 6 months degree, 6 month course thing, and they said, I'm a nutritionist too. Because I think when you use that word, people kind of look down and think, oh, well.
Yeah. Well, the first thing I want to say is that knowledge is not innate. So the knowledge that any of us have, whatever, whether we're a dietitian or nutritionist, it's given by others and it's learned from others. So I just want to make that clear. And I also have met some non-degreed individuals who knew a lot about nutrition because they innately were able to learn through books, through teachers, and things like that. However, there is a distinction between a dietitian and a nutritionist. And I do think that having the actual degree in nutrition with the experience not only in the classroom, but experience in a little bit of the research, I think that that's a very important distinction. The other important thing about a dietitian is that they are licensed within their state, which requires a certain amount of continuing education and exams, passing exams, and they also are accredited through a national level. So the academy for dietitians, nutritionists is a very important distinction to have. Within that academy, in fact, you can become then specialized. So I've been specialized as an oncology dietitian. I'm currently specialized as a dietitian in integrative and functional medicine, which is a really important distinction. Once again, it's integrating everything that we do. The other thing that's important to know is that there's a certain liability behind someone who's a dietitian. You know, they are beholden then to their knowledge base as well as to the different organizations that they belong to. And also, sometimes, depending on your diagnosis, you might get insurance coverage, but you definitely get a knowledge base that's important. And they have a lot of knowledge that they can draw on. So you know that what they're doing is what's called evidence-based nutrition, which means that they shouldn't be giving any advice that doesn't have some research behind it.
Okay. I'm also acquainted with your work, and it's a little more detailed than some nutritionists that I'm familiar with. And I always wanted to ask you this question. What role does your biology background play with your nutritionist?
Yeah, for me, it plays a huge role. And that's because I really believe when you understand the information behind the advice you're giving, it's very important. For example, right now I have an intern who's doing some of her internship with me. Very smart young lady, doing very well. And she did a short presentation on proteins to the patients today. So she knows enough from what she's learned from her nutrition classes and books to tell people what is protein, how to eat it, what foods they should be eating, how much protein they might need. The only thing that the biology degree could add to that is the true biological value, the biochemical nature of exactly what a protein is and how it operates in the body. It just gives an extra understanding. So I use my biology all the time. I try to integrate it into nearly everything I do. Even if I have someone who maybe has some difficulty that's GI, gastrointestinal, and then the doctor wants to give them an antidepressant. Well, some antidepressants actually do affect the GI, system. So it turns out that they'll say, well, I think that doctor thinks it's all in my head, which naturally I can say it is. Everything is in the head. Everything is also in the brain. Everything is also in the immune system. So what's going on in your mind with your mood, what's going on in your gastrointestinal tract is intimately connected to what's going on in your brain. In fact, the old anatomists used to call the gut the second brain of the body. So just by that short explanation there, you can see how the biology is always informing me on how to better teach the patient. And I find that patients are very grateful for that. They're really interested in understanding how their body works.
So you're with all those your trifold, your nutrition, and just correct me anywhere I'm not. Your biology, and is it psychology?
Correct.
With those three, what's your current function of work? How long you've been in that work, and how have those three triune skills have helped you where you're at today? in the field that you're at today?
Right. So currently, most of my work is dealing directly with patients who do have a diagnosis. And I primarily work with cancer patients in oncology, although I do have a number of patients who have, just other disorders that they're working with. But when I see a patient and I assess them, I'm immediately thinking what's going on biologically with them, what's going on psychologically with them, what's going on nutritionally with them, and I'm already integrating all three. I'm also interested in what they know about their own biology and how attuned they are to what they're feeling or how their body is responding to things, and how much what they're thinking and how much their perspective is influencing their behavior, which might be how well they're eating or not, or also how they're feeling. So I'm always integrating all three that way. And I know right now we're going through also this virus crisis with COVID-19. And each day I'm now dealing with patients who have that layered on top of their concerns about their health with their cancer. And I find that if they knew just a little bit of biology about what a virus is or what we do know about viruses, they are much more comforted and much more secure about how to deal with the situation.
Okay. Um, Along those lines, can you tell us, do you do any private work outside of your main work?
Yes, I do. I do a lot of teaching, which I'm currently on a break from teaching. As everybody knows, school is not in session, but that would be university level teaching in both psychology as well as nutrition. And as far as my private work with clients, I see patients who have anxiety, who have difficulty with weight loss or weight gain. I see a lot of patients who have GI situations, conditions that might even be related to grief. So I see patients that typically have a combination of things going on.
I'm looking down here and I'm looking at your resume, and there's something in there telling me in the past you almost went down the path of research. Is that correct?
That is correct.
Lead us down that path.
So what I've done is incorporated the research of others and my limited but interesting experience in research. For example, when I was first in working on my master's, I worked on a nutrient called carnitine. It's a metabolite. I also worked on folic acid, which is a B vitamin. I worked on animal model research. I worked on microbiological research. And then later on, I started doing some clinical research at the University of Virginia. And I was looking at not only diet, but also what was going on, for example, calcium in women runners. And then when I got into health psychology, as I had mentioned before, I worked in oncology with research. I also did a study that looked at salivary IgA, which is an immune factor, but we didn't just look at the immunity. We looked at those individuals' mood and their understanding, as well as whether or not they were susceptible to the flu. And we looked at an age bias there. So I've gone almost all the way through research. There were many times I was very interested in research and almost did that entirely. But my love for being in the clinic, my love for working with the individual person probably has overridden that. So I find that the empathy for the subject, in a research study is where I fall, and I'm more interested in knowing how they're feeling about the research, although my mind is always on the research question, and I'm often sought out by people for research design and things like that. And I also find that my role in life is more about influencing the individual person. So that's where my reward comes. I think research would be extremely rewarding as well. And I was rewarded when I worked with others who had research labs. But for me, seeing the individual influence on one singular person's life is where I get my reward.
Fabulous. I hope this question doesn't get you off guard. Again, we have a great research team over here. It's been said that you've reached out to the National Basketball Association in the past. In reaching out to them, the work that you were reaching out to them to do is a very futuristic work. Do you remember reaching out to them, and on what basis were you reaching out to them on?
Oh, yes. I remember like it was yesterday because this is an example that I've seen in many people's lives when they integrate their work. I actually was at a, watching basketball in Las Vegas. So it was a summer league. And just watching these individuals who had not been the first pick trying to get in. So already I had some empathy for the underdog. They're trying to get accepted into the NBA. And I noticed that some of these very tall, obviously very skilled young guys were sometimes what I thought looked too thin. So here comes the dietitian also now saying, I wonder what they're eating. I really wonder if any piece of their not having exactly the optimal function that they needed to get into the NBA for the first pick. I wonder if any of that had to do with the fact that maybe even their funds didn't allow them to have all the protein they needed or all the fuel that they needed in their training to be able to store enough glycogen, to be able to do their sprinting, their power work. I mean, immediately I just started thinking about that. And then I also knew that accomplishing something like being and thinking you're capable of being an NBA member has to have something to do with your self-image. In some way, you must know or feel, I can do this, I'm able, I'm capable. And if any piece of that were part of what's going on with those individual players, I think that that would be important. Now, I know there's an entire field of sports psychology, and that's an incredible expertise that individuals have, and I don't claim to have that. But in my own just urge to try to reach out and help, especially with some of the skills I have for relaxation, for meditation, for blending some of the same factors like self-image with eating, for example, I thought maybe I could be of service, and I thought the NBA itself might be interested in offering some programs for even current players or new players or players who they felt weren't reaching, where they needed to. So I did write a letter to the commissioner, and I was extremely gratified I got a response. So I had a conversation with not him directly, but with someone else who works for him, a spokesperson. And at the time, they weren't interested. But I have noticed that these different professional sports teams, not necessarily the NBA, but different professional sports teams do offer some of these services for their players. And, I just thought it was a great idea. Maybe in the future one day, they'll take me up on it.
In the field of education, you said you still teach. Are you on any boards? Do you work with any universities, colleges, and so forth?
So the last teaching that I did was at South University, which is a private university in South Florida. And I'm on 2 advisory boards for Kaiser University, which is a small yet growing university also in South Florida. And I've been on both the psychology and also the dietetic internship advisory boards.
Okay. Now, field team also tells us a little about you. We won't go into that, but we still want to know you a little more. And could you give us a little background upon your schooling? We know something is written down here is telling me you're not a person of affiliation. You're not a big affiliated person. However, just getting into where you went to school, where you got your degrees, give a background of that.
Okay. So in explaining why I might not be big on affiliation, I am very attuned to the individuals who I learned from. So I went to the University of Florida first, and now the University of Florida, of course, is a very highly recognized university. It was then too, way back when, but not like it is now. I'm happy to see that. But I went there for my biology degree. I had fantastic teachers, an excellent education there. I left for 1 year to go to the University of South Florida again. I actually went because the author of our organic chemistry book worked there. He was one of the professors. So I went there to get it directly from the author's mouth, so to speak. I had a great experience there. When I decided I was going to go to grad school, I felt like there were more opportunities for my interests, for the avenues I was interested in back at the University of Florida. So I went back to Gainesville. I graduated with a degree in biology and then continued on there for my master's degree as well, and which started out in biochemistry and ended up being nutritional biochemistry with a dietitian internship attached. After that, I had moved to Virginia and then to Tennessee and did my doctorate at the University of Tennessee in Knoxville, Tennessee, which is the eastern part of the state. And once again, was exposed to an unbelievable amount of really excellent and academic as well as integrated work there. I worked under someone who was doing work at looking at forgiveness and heart disease. I also worked with someone who was looking again at salivary IgA, which is an immune factor. So really, really interesting blends of biology. And every psychology professor said, we wish we had your biology degree. And then when I was in comparative and experimental medicine, the biology professor says, wow, it'd be great to go into psychology. So I was really happy that I was able to blend those.
Fabulous. Is there anything else we did not cover that you would like to get into today?
I think I would like to add one thing. Even though I wasn't that old when I went back for my doctorate, I was in my mid-30s. And I just want people to know it's never too late. I met individuals in their 50s and even in their 70s who were going back for another degree. Now, they may not be able to put in a good 40 years into a field, but they could still accomplish something important. And I just want to make sure everybody realizes that. I've also had interns who've been older, than the normal age, and I'm so happy to see that because it really is never too late. I did have someone say to me one time, wow, you must be a late bloomer. To which I said, late for what? It's never too late to bloom. So I would like to add that in if you're doing a history of my academic.
I think that word is very timely word. And I think if nothing in the foreseen future is tapered, I think a lot of people will be going back with the current situation. So it's a very timely word and a word of encouragement. Well, Dr. Collins, we thank you for your time. And we look forward to do many series. So for everyone who's joining us, thank you. We look forward to hosting you again, as always. Christian Balance. Thank you.
Thank you.